My daughter Vanessa was 24 when she passed away.
We lost my youngest son Caleb to an opioid overdose a little better than 2 years ago at the age of 27.
The one thing I have found is everybody has somewhat of a similar story about their children. You find out that their children were very deep-feeling, deep-thinking, very loving, caring people.
Caleb was an incredibly gifted athlete. He was a college baseball player, played here locally for North Carolina A&T State.
Had some depression and anxiety stuff going on. I think that's where she... Unfortunately, I think she spent a little time in the hospital for it, and I think that's where she learned to self-medicate, quite honestly.
We spent a considerable amount of money putting our son through some 90-day rehabilitation programs, which, as we know today, 90 days is just really the beginning.
We had no clue until 2012 when she overdosed on heroin.
It takes 18 months to 2 years of total sobriety for people to begin their path to recovery.
She was in the hospital on life support for, 48 hours or so. That's when it really came to our attention that we had an issue. As parents, you want to believe there's not a problem. And, Steve said it, if we knew then what we know now, right?
Had there been insurance coverage at that time, I think Caleb would have come out of that facility and went into a medically supervised program where not only could his addiction have been addressed, but the underlying reasons.
When all of the insurance laws changed and, the Affordable Care Act came into play, and North Carolina chose not to expand Medicaid in our state. We were actually at that same time trying to find insurance for Vanessa. There was nothing out there. I mean, she was going to be in that gap.
It's very important to our society that we extend the treatment options and availability, particularly to those who cannot afford it, because it can be very expensive.
We're talking about life, whether you're, 15 or 25 or 35 or 55. You need to and you deserve to have health care.
You have a number of people, maybe numbered in the thousands in our state, that want treatment yet can't afford it.
When it comes to the opioid crisis specifically, it takes treatment. This is a good representation of just her smile and how absolutely happy she could be.
Closing the gap is a no-brainer from the legislative standpoint, because this will undoubtedly save lives.
God doesn't want us to be grateful or be happy that we're not having problems that somebody else is having. He wants us to see those problems and get mad and do something about it. This is a human life we're talking about. And there is absolutely nothing so important as helping people get better and save themselves and save their life. I miss her every day. But, we carry on, and I carry on with this fight in her honor.